Welcome back to Fresh Living. We are all hyper aware of the role healthcare workers play in our society right now, especially. And joining me now is Dr. Joseph Q. Jarvis, who literally wrote the book on American healthcare. Hi, Dr. Jarvis. Thanks for joining us today.
Thanks for having me.
Okay, tell us about your book called The Purple World, and how did you decide on that title?
I wrote the book a few years ago after thinking about how hard it is for people to get good care in the United States. It's a bunch of stories about my time in public health in Nevada and elsewhere. The title comes from a lecture when I was a freshman medical student at the University of Utah. Our microbiology professor wanted to impress on us how dangerous the microbial world is. So he kept repeating the line, if urine were red and stool were blue, we'd live in a purple world. He was trying to emphasize how important it was for us to do basic hygienic things like wash your hands and think through what our patients might be exposed to. Well, of course, today's COVID outbreak tells you all you need to know about how dangerous that microbial world can be. But I apply the purple world as a dangerous place to American healthcare, a place where harm happens. 400,000 deaths a year occur in the United States due to preventable injury to hospitalized patients. So we can do better. We need to do better.
Wow, yes, we do. Okay, in The Purple World, you talk about communicable disease outbreaks during your time in public health. Can you tell us a little bit more about that?
Sure, it's a very common experience. We invented public health 100 or so years ago because of communicable disease and how we needed to control it. All of these ways of doing it with contact tracing and testing, these are all things that we need all the time because outbreaks happen. I took care of outbreaks for hepatitis A, syphilis, plague. Plague is common still in the American West. These things are commonly occurring just like respiratory outbreaks like COVID and flu.
And doctor, what should we be learning about COVID-19 right now?
Well, to further that about how common outbreaks are, we need to recognize that we were not ready for this. We should have been. It's been known since well before my time in medicine that an outbreak of a flu-like illness like this was going to happen again. It happened in 1918 with the Spanish flu pandemic. We need to up our game. We've got to prepare our public health agencies as the thin blue line between us and the microbial world. We need to stand behind them and fund them and help them be trained and ready to do the protection that we require. That's what we should take away from this.
Yes, okay. And what can we learn from your book, and who should be reading it?
Well, I wrote the book for every American to try to help them understand what's going wrong in our healthcare system, from public health to the highest level of acute care and intense care in a hospital. We need to change it. We're harming ourselves. We're paying through the nose incredibly large amounts of money and not getting a return on it. I intended everybody to try to read it and understand what are the problems and where do we go from here? How do we heal the harm in our healthcare system?
Oh, I can't wait to read this book. Where can we get a copy of The Purple World, Dr. Jarvis?
You can get on my website, thepurpleworld.com, where we're actually having a contest, and we'll be giving out free copies of the book. Or you can buy the book from any online book purchasing platform.
Fantastic. Thank you for joining us today, Dr. Jarvis, and stay safe out there.
You too. Thank you for having me.